Okay, well, I don't have a presentation per se, more some comments and observations on some of the statistics that we've seen to help put things in context from a business community perspective.
Oh, and let me just interrupt you just to be awful. The reason that we reached out to Craig not only is because he's on the task force, but he's also the president of the Everett Downtown Association. We thought that was a logical place to reach out for talking about some of these issues. So keep going.
Thank you. So one of the things that you hear commonly about Everett is that it has a lot of potential. We're surrounded by water, we have amazing views, and we've got a historic downtown with walkable streets. And you look at some of the plans that we've seen tonight for the riverfront, the station area, the waterfront, and yet we haven't achieved our full potential as a community. And so, that leads to the question, why aren't we achieving our full potential? And I think a big part of that answer is because we're missing key opportunities. I can give you one example. We were approached by a regional insurance firm that was looking to relocate their headquarters office from Vancouver, Washington to Everett. And they spent part of the day exploring different office buildings downtown, and they found a space they thought would work for them. And we had a letter of intent signed with that company. They came back, spent another day walking around downtown, exploring the city, and they felt that it didn't feel like a safe and comfortable environment for their employees. So ultimately, they chose not to locate their office here. And that was a missed opportunity. So if you're Seattle and you've got companies like Amazon and Microsoft and Google powering your economy, you can miss a few opportunities and it won't matter. But with Everett, when you're trying to get to stage one with your economy, you've got to take advantage of every opportunity. So I think one of the key things that I'd like to express is that when you think in terms of economic development, it's not just about the riverfront, the waterfront, the major areas of the city. It's also the daily interactions that people have on the streets. It's the daily interactions that they have where they choose where they want to live, where they want to shop, where they go for entertainment. And unfortunately, the challenges that we're seeing on the streets are causing us to miss opportunities in our community. I'll give you a few more examples. I've heard from people who no longer want to take their kids to story time at the library because they don't feel comfortable going into the main entrance. You've got people outside swearing. You ride the elevator, it smells like urine. That's a missed opportunity for the library. They miss a patron that can support their institution. It's a missed opportunity for the coffee shop at the library to sell, a $10 transaction. It's a missed opportunity for downtown. We've had apartment residents who have made a decision not to live in downtown Everett because they don't feel comfortable on the streets. And that's a big loss because people who live in downtown, on average, spend 3 times more than a person who works downtown or visits downtown. And each time we lose a resident that chooses to move to a different place like Bothell or Linwood, that's a loss for the small businesses downtown. We also have business owners that are struggling. They're doing all the right things. They're working 6 days a week, and they just can't seem to make it. We're seeing a lot of retail turnover, a lot of restaurant turnover, and the challenges that we're seeing on the streets are adding to their burden, and it's been a real challenge. So, these are just a few examples of what's happening on the streets each day. And if we want Everett to reach its full potential, we not only need to do what we can to break the cycle of homelessness, we also need to do what we can to break the cycle of what's happening on our streets. So The handout that I shared with you today, I think is a good example of some of the challenges that cultural institutions are feeling downtown, that businesses are feeling downtown, and also residents are experiencing downtown. We do have one success story at Library Place, Home Street Bank. We were able to recruit them to the community. And what did they do? They donated $5,000 to the Cocoon House. And they committed to donate $50 to Cocoon House each time a person opened a new account. And that's the kind of activity that we need to see downtown. We need to see more businesses like Home Street Bank. We need to see more residents living downtown that can support stores. And if we don't change what's happening on the streets, we're going to be missing those opportunities. Thank you.
Thank you, Craig. Are there questions for Craig or comments here? Then I'd like to invite Sean to come up. Sean Straub, who works with Experience Everett, and I'm told he knows almost everybody in this room.
It's a tall order. So I do know many of you, and I thank you for having me here today. Kind of on a personal note, unbeknownst to probably most of you, I actually grew up about a half a mile from Casino Road, and have dealt with a lot of the homeless issues in my own family and mental health and everything else. So I have a very personal connection to this issue. Happily, though, I've been able to overcome that myself and have a wonderful job as the owner of a small business here in Everett. And one of my clients happens to be the city of Everett. We manage their tourism services, and we've created an initiative over the last couple of years called Experience Everett. And we have the exciting task of trying to get people to come here from around the region, from all the way from Vancouver to Portland and beyond. And so it's really exciting to be able to attract people to Everett. I have a lot of passion for the area. It's a beautiful place, as Craig mentioned. There's a lot of fun things going on here with development, new public market, new apartment buildings, some wonderful things at the waterfront on both sides, actually. And some really first-class attractions. You know, we have the largest building in the world with Boeing, and the Children's Museum and the Shack Art Center, and all these wonderful things in our town. And one of the things that can sometimes be challenging, and what we look at when we're trying to promote the area, is much like you would do when you're selling a house. You know, it's curb appeal. So the first thing is your first impressions, and they're everything. And so recently, the Downtown Everett Association and the City of Everett came together to do a new gateway project that will clean up several of our gateways into the city, which is fantastic. But those first impressions go beyond just the gateways to downtown Everett. They go, you know, to South Everett, and also just the impressions throughout as you're driving through our downtown core and other areas. And sometimes that can be concerning. You know, as you drive around town, I'm sure you notice a lot of the same things I do, and sometimes it's not exactly becoming. And when we're trying to recruit a bunch of people here, next weekend, as a matter of fact, we have a huge fresh paint art festival, a craft brewery festival, a food truck festival, a bubble run, and we expect almost 25,000 people to come to town next weekend. You know, conservatively, we estimate that those 25,000 people will spend over $1.5 million in our community. We work really hard to bring them here, and we want to make sure they have a great time, and we want to make sure they come back, most importantly. If we're taking a ton of our resources and time to recruit them here and get them to drive from Vancouver and Portland and Bellingham and Seattle and beyond, we want to make sure they have a great experience. You know, I can remember the first time I went to Whistler. You know, it was because of a large festival. I've probably been back 15 times since because I had such a great time. Had that first experience not been good, I probably would have never been back. So that first impression is so crucial to the visitors that we bring to town. Not only because of the experience they have as a visitor, but also because ultimately we want them to live here, work here, play here, shop here, time and time again. Everett's very unique in its quality of place. It's beautiful. We have, like I said, some very first-class attractions with Boeing and our Children's Museum. We also have a lot of value and convenience. Our hotels are about 40% less than Seattle, which is fantastic. The convenience of free parking is a huge sell for people that are used to paying $20 in Seattle and some of that. And Bellevue's actually been a model of that in the fact that at Lincoln Center and Bellevue Square, there's free parking provided for their shoppers. And so we're constantly looking at who our competition is as well. We look at Bellingham and Fairhaven. We look over at Snohomish, Bothell, Mill Creek, Seattle, and Bellevue. And we need to take note of what they're doing and how they're creating a visitor experience and making sure that our visitor experience is comparable if we want to try to continue to recruit those people. Some of the challenges, other than the perception and stigma, are some safety concerns, honestly. Last year, actually about exactly a year ago, we had an incident at our food truck festival, which really undermined the entire weekend. We had probably around 10 to 12,000 people come through for our craft beer festival and food truck festival last year. And it only took one person to really kind of put a damper on things. And this gentleman, I believe, was suffering from mental health issues. And he decided to climb on top of a building on Hoyt Avenue while drinking a high gravity malt beverage and become very disruptive. And it was sad because it was a family event. There was a lot of people walking around the street taking notice of it. I did my best to address the situation at the time. And thankfully, due to the police officers, the bicycle officers that are in the downtown core, we were able to resolve it quickly. But not before, unfortunately, he decided to drop his pants and show a bunch of children and families something that they probably shouldn't have seen. So those are things that we deal with. It's not often. It is here and there, but it is something that concerns us a lot as we try to work hard to create good events and show off our wonderful attractions. The other thing that was really challenging for me personally, given the fact that we've been doing so much. We have over 15,000 social media followers now, and we're constantly getting written up in papers about what we do and in different media outlets throughout the region. And all it takes is little things here and there to disrupt that. So not all of it is related specifically to mental health, poverty, and homelessness. This particular case was more of a crime-related incident, but you may have heard about the woman whose belongings were stolen from the Best Western a few months ago. That literally came out about a week after a big article that we had for a music festival, and that particular incident ended up making national news. I actually saw it on the Wall Street Journal. That's not good when we're working so hard to create so many good things, and one little thing like that can undermine it all in a heartbeat. So I just want to leave you with that. Some of the things that I think that could help quite a bit is just addressing, we've spoken about maybe creating an alcohol impact area within the downtown core. I know that would help me with some of my events that I do and addressing some of the problematic issues we see on a regular basis. I think that'd be one of the biggest things. And then also, the bicycle officers are imperative. When we really notice a difference when we don't see them in the downtown core on an often basis. And so I'll leave you with that. Any questions?
Questions or comments? Yeah, Lainey. Give the mic for Lainey. Thank you, Ann.
My name's Lainey McMullen. I'm with the Mayor's Office, but I'm primarily tasked as the Executive Director over Economic Development. And I've noticed in this section, when we were going to talk about how businesses are affected and the growth and vitality of our city by some of these issues, there were questions that were not addressed by Dave, who he saved them out for me, so I'm going to take just a minute to do that. This issue of street issues is probably about one of the top three issues that I face on a daily basis when recruiting investment into the downtown core, or really any place in the city of Everett. It has no more to do with homelessness than other street issues, so I want to get that clear right now. In fact, probably homelessness, because of our extremely wonderful nonprofits who deal with that, is probably better here than I think in other urban cores. But there are other street issues that I just want to make sure that gets addressed, because they're as detrimental to the economic development effort as homelessness may appear to be. We always wonder why it is that we don't have more services, more restaurants, more this, more that in the downtown core, more retail. Why don't we have a Whole Foods? Linwood has a Whole Foods. Why can't we have one? All of those questions can be answered pretty quickly by saying that retailers are very savvy these days. They know who their customer is, and if they can't count what they need to keep their store alive in a 2-mile ring or a 5-mile ring or a 10-mile ring, then they just won't come. We've got obvious geographical reasons for the fact that those rings are problematic for us. Geographically, a third of the ring is in the water of a 10-mile ring, a third of the ring is in ag land, and what's in between is not very dense. So right there, just density, and we're trying to fix that with the housing that you've seen Dave show. But much of that demographic is figured on median household income, and that's a challenge for us as well, because previous, and with good reason, I know that cities all over the United States did this. We aren't the only ones. A lot of low-income housing has been situated in a downtown core. But with that kind of median household income, all situated in a very concentrated area in a downtown core, it makes it almost virtually impossible to attract retail until enough of the higher demographic of median household income moves in to kind of balance it out. Adding to that, of course, are the things that are happening on the street level. It is not all homeless folks. In fact, to my way of thinking and what I see and how I lose people from coming into the downtown core, probably are just as much affected by the people who actually live and are not homeless in the actual downtown core. We have a number of old retail buildings that sit in the downtown core that are in great need of improvement. They're substandard housing, is a polite way to put it, that have living quarters above that are what we call sleeping rooms only. And the inhabitants of these places are sometimes problematic on street level. In fact, it has been more than 2 or 3 or 4 or 5 times that I've watched homeless people actually victimized by folks that live in these kinds of housing and have issues that run the gamut of everything we've talked about. All right? So concentration of where we put what we allow in terms of substandard housing, and I'm not talking about subsidized housing here, there's a difference. But even where we place good subsidized housing is a consideration in how the flow of our economic development goes into our city. I have been sitting with people who wanted to bring family restaurants into the downtown core, and after a lunchtime, sitting in a restaurant watching some residents of Housing Hope be harassed by some residents of the building across the street from Housing Hope, in which a fight ensued, and our finest had to come and break it up. He turned to me and said, "You know what? We thought this would be a good place because it fits our demographic, but we don't want to invite families down here." And this is just a snippet of what I hear on a daily basis and why it's in all of our best interests to figure out how to take care of everybody, as well as who are housed in a downtown core. And I won't say any more unless anybody has any questions for me.
Questions for Lainey? Thank you for filling in on that one. So, and great job on the time, folks. We have 1 minute left. So we've talked about vision and opportunity that's here. We've talked about where the city would like to take the commercial areas, that it's more than just downtown, multiple commercial areas. We've talked about things the city's working on, limitations of the city's capabilities, concerns of the business community and folks that are trying to make the downtown more vibrant. So it's sort of, I think it's a good counterpoint, and it sort of also shows a lot of the complexity of the challenge here. And so I think hopefully this will help get us grounded as we move through the learning phase and get towards so what do we want to do about this phase? So with that, I think I would like to ask Ken, who has been waiting patiently, to come up and speak to us. Now, Ken's the person responsible for me totally burying your email box, and you have 200 pages in your packet from Ken.
More coming.
More coming. Oh, joy, oh, rapture.
Now, I was given a list of questions also.
Yes, he
and
was.
There's no way that in today's meeting I can go through all of that.
That list of questions appears right after his 200 pages of reading material for you. It is in your packet if you are interested.
And that's why I have more handouts.
Awesome.
Give you reference documents that when you are bored to death in the evening or at work, hopefully you don't get bored at work, you can read some of this stuff and answer some of those questions. I really am only going to review a one-page document that I'm passing around first. That's the first one. As that's going around, I'll start the second one until I get to like the fifth and sixth one. There's enough for everybody.
Yeah, we need a microphone.
Yeah. I know you're excited and waiting.
Well, you do have great volume control here, but I'm still going to give you a mic.
I'm going to use the mic once I get to talking. Right now, I'm just babbling.
Really? I thought he was talking right now. Okay.
Right now, I'm giving no content. I'm just sort of explaining what I'm doing.
That's okay. That's context. That's important.
In fact, probably what I'm going to do is stand up at the podium so I don't have to hang on to a...
Can I help you with any of these handouts?
No, I got it. I got it
You
handled.
got it?
I'm used to multitasking.
So while Ken's handing that out, I love the conversation earlier. And I just wanted to balance it a little bit. I work downtown Everett. We encounter homeless people and some other folks who sleep on our porches and things like that. But I also bring my children here. I walk around downtown at my lunchtime all the time. I don't feel unsafe. I think it's important when my children and my husband and I are having dinner on Colby in the evening and we see people who are struggling with social and life issues that we educate them about those are sad stories and it's a reality in life and it's not unique to our neighborhood and it doesn't make our city or our neighborhood bad. And I just really want to say that, like, I have great experiences, and I actually encourage my children to say hello to the people sitting on the street because they're human beings and they're someone's child.
Thank you, Tina. Appreciate that.
If they're 80, they're someone's child.
That's true. Okay, how are we doing? Are things mostly making it around? We got everything handed out? Where's
Documents are coming. There should be, I didn't count them, 5 or 6. You'll know if you're missing one when I get to the end of my presentation. So as they're going around, one of the things I was asked to do was to talk about the County Human Services Department and what we do, and maybe a little bit about funding. And I'm not going to go over that in detail, but what I did put in your packet is one of these things. I had to blow it up because I couldn't even read it when I printed it 8.5 by 11, and I still have trouble reading the small print now, but this is essentially the Human Services Department. And I'm going to talk a little bit about it, not spend a ton of time on it. Our budget for 2014 is about $84 million, and a little more than 2/3 of that is state and federal money. We get very little county general fund, only about $2.9 million. We do get about $23 million in county restricted funding, and that's money that comes to us through various kinds of fees or taxes, but it's dedicated. Some of it we can only use for mental health, some we can only use for alcohol, drugs, some we can only use for developmental disabilities. Very, very targeted dollars. And within those two, at the top on the left-hand side, you see the federal is about $28 million. That really encompasses multiple contracts from multiple federal agencies that have multiple regulations that require multiple reporting requirements, none of which coordinate with each other or talk to each other. It makes it very difficult to manage for us and for the entities that we contract with. Similarly with the state dollars, we get about $28 million in state funding. The predominant agencies that comes from are Department of Social and Health Services and the State Department of Commerce for the housing and homeless kinds of activities. And we also get some money from the Department of Early Learning for our early learning programs. But let me go across, if you go under those revenue areas and you look down to the expenditure, the first line starting on the left, and I'm going to go from the left to the right. I'm not going down the column. You can read that later. That gets into a lot of detail that I'm not going to talk about today. But the major categories, we have funding for alcohol drug services. We have funding for veteran services. We have funding for mental health services. Although I might add, the majority of mental health funding, state and federal, does not go through the county. It goes to what's called a regional support network. And we are in a 5-county regional support network that is Snohomish County, Skagit County, Whatcom County, Island County, and San Juan County. And the entity that gets the money is called the North Sound Mental Health Administration, and their office is in Mount Vernon. Then we have this area that we call Children and Family Services, and that includes WSU Extension, that includes our early learning programs, the state early learning programs called ECAP, Early Childhood Education Assistance Program, and the federal counterpart, which is Head Start, and it's really early Head Start. Then you get this administrative services section, that's our budgeting and contracting and all that good stuff. Then we have developmental disabilities, we have long-term care and aging, and we have case management and home care services. And then we have all the housing and essential needs and community services, which includes not only the housing where we're funding building of buildings or purchase of property, but also vouchers, also outreach. And we do energy assistance and weatherization as well. So lots of different stuff. And if you want to ask me about any of that stuff later, after you look at this, it may help you get some questions. Feel free to call me anytime or come visit me and I'll explain it in minute detail to the point where you'll tell me to stop. So there it is. That's us from a budget and expenditure standpoint. Okay, now on to what was first in my packet, which is a one-page sort of outline called Everett Community Streets Initiative. Number 1, Human Services Department Overview Services and Funding. I just did that. I'm not getting into the detail, like I said. I just gave you a document. You can get as much information as you want in detail about our funding and how much goes into different areas. I do want to say that we are into some major changes coming up in health care. As you all know, the Federal Affordable Care Act and the implementation of that act in the state of Washington, where more and more people are being eligible for Medicaid, and that the state is moving more and more toward doing managed care contracts rather than fee-for-service contracts for public health care services, which would include physical health, mental health, and chemical dependency. One of the things, one of the pieces of legislation that passed this year, which is Senate Bill 6312, I think that was a number. Is that the number, Tom? You remember? Yeah, 6312. It's behavioral health purchasing. It is moving the money for public chemical dependency treatment out of the counties in a fee-for-service environment and putting it in with the mental health funding at the RSN, Regional Support Network, North Sound, that I talked about a minute ago. So the chemical dependency money will go in with the mental health money, and it will be managed by that regional entity, not by the county in the future. And it should be a benefit to the 5-county region, because once you put a program area into managed care in Medicaid, then the federal law says that you must provide that service at parity to any other medical condition. Right now, the alcohol drug treatment system is so undercapitalized, it is contributing to some of the very issues that we've been talking about, and I'll get to more of that in a little bit. So, 2, the biggest unmet needs in Everett, and how would you expect this to change in the next decade? And Everett's no different than any other city. Safe, affordable housing is probably the biggest need. Safe, affordable housing. Adequate, accessible health care. And that includes addiction treatment, mental health treatment. Living wage jobs and training to get people so they can get those jobs. And then accessible transportation systems so that you can get to services, you can get to entertainment that you want to do, you can get to your job, or you can get to school and the training that you're taking. Those are, to me, the four biggest needs of any city, any town. And Everett's no different. And going back to what Craig talked about earlier in terms of what some folks in the city feel and folks outside coming into the city feel about not feeling safe. And I understand that. But I can tell you, I feel a lot less safe walking in downtown Seattle than I do in downtown Everett. But even though that's true, downtown Seattle is so much more vibrant because there's a ton more people out there and more businesses. So it may very well be that some folks feel safer just because there's so many more people around and so many businesses open. But that's just my opinion. Oh, by the way, I do need to do a caveat. The data that I talk about, I'll tell you the source. The opinions that I talk about, and with me, you get a lot more opinions than you get data. The opinions that you're going to get are mine and not representative necessarily of the county council or the county executive. Just to clear that up. Okay, so then there was a question about what is all these things I have listed here. What is the continuum of care? What is the Partnership to End Homelessness? What is the Homeless Policy Task Force? What is Everyone at Home Now, the 10-year plan to end homelessness? And what is the Housing Characteristics and Needs in Snohomish County, which is referenced by many people as the HO5 plan? And what is the Affordable Housing Alliance? And I threw an extra one in there just for Dave Koenig and me. And that is, what's the consolidated plan? So let me go through and touch just briefly on those. All of those entities do have documents that talk about them and what they are and the goals, the mission, the vision, and I think most all of those are on our website, the Human Services Department website. Except for the Housing Characteristics and Needs in Snohomish County, the HO5 plan, and you'll find that on the planning departments, the county planning department's website. So the Continuum of Care plan is really a HUD requirement that talks about how are we going to end homelessness, and there's all kinds of regulations and some funding there, and there's so much overlap with many of these, but I'll touch on that as I go through. That a lot of the Continuum of Care plan is focused on families. And there's a major push where the feds are sort of moving away from just sheltering people and doing transitional housing and really pushing what they call permanent housing and rapid rehousing. And that is, on one hand, something that's good. On the other hand, without adequate resources, that it's very difficult to take somebody who has been living on the street with serious mental illness issues or addiction issues or both, and put them into a permanent housing situation with no services right away. It just won't work. They'll end up wreaking havoc with their neighbors, or if it's an apartment, they'll end up getting the boot because they violated a rule or two or five. So there's some challenges with some of the federal priorities that are pushing us. Not to say that it's not a good idea to prioritize families, always a good idea to prioritize families. Now, the Partnership to End Homelessness, that is a group that is now formalized and is in fact the board, if you will, community advisory board that is advising the county on homelessness issues. And there's a whole bunch of people on that. And I think in the packet, one of the attachments is a list of different entities and people on those that work for those entities or represent those entities that are on that particular advisory board. And when you look at that list, one of the things you will notice is there's a spot on there for somebody from business and industry, and it's vacant right now. So anybody around this table who is from business and industry and wants to get more involved with a very broad collaborative group called the Partnership to End Homelessness, please let me know, because we are recruiting for somebody from business and industry. Everyone at Home Now, that's a 10-year plan to end homelessness that the county did. The county was hoping between 2006 and 2016 that we would create about 2,500 new affordable housing units. And I think we've created maybe, 1,000, 1,100 as of now. It's challenging. Affordability is getting tougher and tougher to deal with because costs are going up and up. So affordability is becoming extremely challenged. Housing characteristics and needs in Snohomish County, I think Dave even kind of referenced some data out of that, which really is looking at between now and 2035, what are the housing needs across the county, not just the city of Everett. And there's all kinds of really good data in there for you guys that are data-driven or have to write reports that have to do with, area median income or housing needs projected by population group or income level across different areas of Snohomish County. You want to read that report. It's worth looking at. The Affordable Housing Alliance is an alliance of cities in Snohomish County, including Everett, including Snohomish County, that have come together formally with an interjurisdictional agreement to look at issues around affordable housing. And that's a fairly new group. Housing Authority of Snohomish County is really acting as the entity that staffs the work of that particular group, but hopefully that group will be able to come up with some recommended solutions. And some of the recommended solutions they may come up with will be the same kinds of issues we're talking about here that are needed. What's the capacity of shelter, transitional housing, and subsidized permanent housing? I'm not necessarily going to talk about that now. There is a handout in my packet, but I think you already got that data from Dr. Fenn and Nate previously, so I'm not going to review that. Is Everett, I love this one, is Everett a magnet for homeless persons needing services? You notice I didn't put anything in there? Because really that's a discussion, and anybody who answers that is stating an opinion that can't give any facts related to it. What I can tell you is regardless of whether or not we had affordable housing or even specific housing for the homeless in the city of Everett, or mental health services or alcohol drug services, any urban area is going to be a magnet for a number of different people. Why? Because there's people there, and where there's people, there's possible money. And there's restaurants there, and where there's restaurants there, there are usually, garbage bins out back where you can go dumpster diving and get food. So it's not just about services being available for homeless that attracts homeless folks. It's a whole lot of different things that cause people who have no place else to be to go. I'll tell you one thing, when I was homeless in the 60s, and I went to Haight-Ashbury in San Francisco. Probably a mistake, but I went there anyway. And I went there for a whole lot of different reasons, which we're not going to talk about, and I don't want in the newspaper. So, 6, what is the most promising strategies for ending street-level social issues? And are we deploying these, and what will it take? That's really got to be, in my opinion, a discussion of this group where we can debate each other. We're not always going to agree. I think we all need to respect each other when we state opinions that maybe we don't agree with, but we need to talk about those things that'll eventually end up, as Karen alluded to, in some solutions that we can all hopefully pursue. But what I will say is, you go back to section 2 in my handout, and that is the safe, affordable housing, the adequate, accessible health care, the living wage jobs and training, and the accessible transportation. That's really what works to deal with social issues. And we need to do whatever we can to get there, and that means ensuring there is a mix of housing at different costs. Now, I don't know how many of you read a lot of these technical reports, but again, the HO5 report, it talks about what's the area median income for different cities and the unincorporated areas, excuse me, of Snohomish County. And so that report says that the area median income for Snohomish County is about $49,000. The only area that is lower than that is Darrington. Now, some people might argue that the reason it's so low is because we have so much low-income housing. I'm not sure that's the truth. You can make a lot of assumptions, but I'm not sure that's true. I think there's a whole lot of other issues. That report also talks about how many people are cost burdened in terms of paying their rent. And if you use some of the federal definitions, cost burdened, you are considered cost burdened if you are paying 30% or more of your gross household income on rent. That's what cost burden is. 50%, according to that report, 50% of all the people renting in the city of Everett are cost burdened. Which makes sense if we're one of the lowest areas in terms of area median income. I listed a whole bunch in number 6 of entities that really need to all work together to take responsibility. You know, in the documents that Karen read at the very beginning, you know, the feedback from the homework, I think people got it right. I mean, there's a lot of really good stuff going on in the city of Everett and in Snohomish County in terms of collaboration, but there's a whole lot more we could be doing. A lot of the systems tend to coordinate and collaborate within their silo. Like the mental health people coordinate well together, the alcohol drug people coordinate well together, the fire district people do well together, the law enforcement folks do well together, the health plans do well together, but, well, maybe not them because they're competing for another story. But we don't see a lot of collaboration across those silos on a regular basis. It's beginning to happen more and more every year. It's becoming an absolute necessity for us to coordinate. And I can give you examples where the City of Everett Fire Department is coordinating with our department, their EMS, and they're also coordinating with the health plans, at least one of the health plans, Molina, to try to identify folks in the City of Everett who have high needs but don't have a lot of resources. And they are becoming a burden to Providence Hospital, recycling in and out of the hospital emergency room, or hanging out in the streets, or going into the library using the bathroom, or running into the senior center to use the bathroom, whatever. That coordination across those systems can be effective, and we're seeing more and more pockets of that. I know Julie and Providence Hospital are doing much more discharge planning of people coming into the hospital emergency room, because they know that if all they do is release folks into the street from the hospital emergency room, when they know they're homeless or they know they don't have any other services, they know they're going to be right back within a day or 2 or 3, costing a lot of money. The jail, same thing. We've been talking with the sheriff on doing better jail transition services. We're talking about trying to create an alternative to the jail above and beyond the triage facility that Compass Health runs, that has been very effective at reducing costs at the hospital emergency room. So there are pockets of good collaboration going on. Linda Grant in Evergreen Manor runs a number of chemical dependency programs in the city of Everett, including the 16-bed detox. But that detox is full all the time. And so you can't get people into it in order to do some of the things we need. So Linda is working with a coalition of folks in South County to look at opening a South County detox that can help take some of the stress off of Swedish Hospital in South County and South County law enforcement and EMS. Some of the EMS folks, Fire District 1, for instance, has a grant. This is outside of Everett, but it's another example of some things that are working. They have a grant from Verdant Health Commission to essentially implement what's called a community paramedic or community paramedicine program. And that is to identify people who they get dispatched to from 911 who clearly need services, but they don't necessarily need medical services. They need other types of services, rather than them taking them to the hospital emergency room that we know maybe they don't need that service. Try to do some other kind of care transition coordination. So anyway, enough said. There's a lot of good stuff going on there, many pockets of excellence, as some people would say, but we need to expand a lot more. And the only way that that can happen is we all have to be willing to talk with each other and share information and partner. and that the business community has to be with us on that. So, what are the most important things for this task force to understand about challenges of addressing street-level social issues in downtown?
We gave him all the easy questions, you can see.
I kind of like my answer on that one. We're all responsible for the solution, every one of us. Finger pointing solves nothing. Can't arrest our way out of it. That's not going to work. A lot of this is a social issue, not a legal issue. Although if we don't deal with it, some of it becomes a legal issue. There's no doubt. We must be willing to try new strategies. We can't just keep doing the same thing. Even if the thing that we're wanting to do the same of is working, as the demand goes up and the dollars go down, if that thing that we're doing is too expensive, we got to find a cheaper way to do it, but still have effectiveness. And I have a few personal opinions on that I'll mention in a minute. And then working together is essential, and I'm just continuing to stress that all the time. So let me throw something out. The not in my backyard syndrome is a pain in the butt for any of us that are trying to figure out how to create solutions. I understand the not in my backyard syndrome of being fearful of locating services or housing for somebody who's low income, close to my neighborhood. I understand those fears, but I also know that you are never going to not have low-income people living in Everett. And as much as we all have these great goals of ending homelessness by 2016, there's always going to be some people that are homeless, regardless. But at the same time, we can minimize that. And once they are homeless, what isn't going to be sustainable is if we have to spend $250,000 to $350,000 for every so-called affordable housing unit that we put together. That's not sustainable. I think we need to do a lot more of that for families, but for the singles, there are some other things that could be done. I hear about some of the concern of these folks in Seattle who are doing these apartments. Some of you have probably heard those apartments, where it's really housing that wasn't geared toward people who were homeless or necessarily poor. The folks in Seattle did it to create housing for folks who kind of worked in downtown but lived elsewhere, and they were making good money, and they just wanted a place to crash in the city during the week. And so they build these apartments, kind of like student housing, where you have your own sleeping quarter and a little toilet and shower, but you share the kitchen and the living room. It's a pretty low-cost model. They're making money doing it. So why can't we look at that model for the homeless? It's a model that could work. There's a lot of countries, China, Denmark, tons of countries, that are taking shipping containers. Those shipping containers are piling up in many, many parking lots because they are only allowed to be used, I think, for about 10 years as shipping containers on the big ships. But those things can last a lifetime. They got to be taken out of service. So they're stacking up. They're stacking up all over the place. And there's a place in Ballard, locally, they're not Seattle, they are Seattle, they're not Everett, but locally within an hour's drive with the traffic, they're converting those shipping containers. They're making some really neat, what I would call studio apartments out of those. 8 by 20, $35,000. They're plumbed, they're wired, they're insulated. They have a bed in the back, a little kitchen, a European-style bathroom, where the toilet's in the shower, and the shower's all, I'd have to get used to that. Have to wipe off the toilet, but, you'd get used to it. They do it in Europe. If it's good enough for them, it's good enough for us. $35,000, and you can bring those things up. And gee, guess what? In Baltimore, somebody finally got the bug in Baltimore, and they're using those shipping containers and stacking them and building apartment complexes for low income. one of the few places in the United States that I've seen them using them as apartment complexes. They're being used as apartment complexes in many other parts of the world. But we have to be willing to try new strategies. That isn't to say the old strategies that are working have to be thrown out the window, but we need to add to them additional strategies, something that may be a little different. And though, I got to tell you, have any of you Googled shipping container housing? Yeah. For those of you who haven't, please do Google it. You'd be amazed at some of the neat things. And those places, they don't look dumpy. I mean, they got windows in them, they got sliding glass doors, they got heat. There's some folks that are building multi-million-dollar special designer housing out of shipping containers. It's absolutely astounding. I'm not talking about that. I'm talking about $35,000 per unit studios instead of $200,000 per unit studios. That's not sustainable. Anyway, I'll end there. Questions?
All right. Sophia, up first. Where's the closest mic?
Thank you so much for sharing your comments today. I have to say a little earlier when I was hearing a little more from the business area, I was a little disencouraged by that message of having others considered customers and not really the people or the residents of our community as customers as well, including our homeless population. And it's really visionary to think that we can provide not only housing but better services to our customers regardless of their economic status. So thank you for your comments.
Thank you. You know, one thing I might mention is I was a bit of a tyrant back in the 60s and early 70s, and a bit of a activist. And that what I remember back then, and living in Seattle at the time, South Seattle, Rainier Valley, that I remember the central district of Seattle back in the early 60s, which is where the poor folks lived. And then as you watch sort of a decade go by and you look at the city trying to do economic development, which they needed to do, eventually it caused the property values to go up, which is a good thing. But as the property values go up, then the poor people who owned houses there all of a sudden now can't afford to pay the property taxes, so they get pushed out. And then the rents all go up, so the poor folks get pushed out. So everybody got pushed out of Mount Baker and Central District out to Rainier Valley. I was one of those that got pushed out. And of course now, they've pushed them out even further. They pushed them out to Kent, they pushed them out to Auburn. And now the city of Seattle is trying to do more affordable housing for poor people. You know what? You know how expensive it is to try to create housing in downtown Seattle? It's not affordable. It has to be subsidized at such a high level, it's crazy. Hopefully, the city of Everett can look at that and say, we don't want to find ourselves in a position 20 years from now when land around downtown Everett is so expensive that we're having to try to build affordable housing to meet the need at that price. You have an opportunity to create affordable housing now, along with other expensive housing, when the land is cheaper today than it will be 20 years from now. So I really believe that that is something we need to look at.
Okay, go ahead, Cassie.
I also want to commend the comments about trying something new. I am very excited about that, and I have thoroughly researched the shelter craft that in Ballard as a solution for some youth housing for cocoon house expansion. Cool, it's very cool. Very excited about it. But I did want to ask a question. You know, you highlighted how important it is for us to collaborate outside with each other, and we're doing a pretty good job of that at Cocoon House, and I know a number of other providers are as well, partnering with law enforcement. We're partnering with law enforcement in Arlington, but currently no one is funding these collaborations and this coordination of services. We meet as service providers on the Homeless Policy Task Force. We attend these types of meetings. This is not a grant-funded thing that we're doing, right? And I know none of you are being paid to be here either, but asking nonprofits to and other providers to and the law enforcement and fire departments that are so underfunded, having that be part of the solution, I think is very important and essential, but we have to find the resources to do that.
And Cassie, I would agree with that 100%. I mean, it's true for the county staff too. that one of the challenges I think we do have is there are, and this is one of my opinions again, just to be clear about it, there are so many task forces and committees, many of which are overlapping right now. I could spend all 40 hours a week of my taxpayer-paid salary just going to these kinds of meetings. We have to figure out how to make these kinds of meetings more solution-based, short-term, not overlapping with the other ones that are already going on. It's going to be crucial, because I know the city staff are in the same position. There's just, you get buried in meetings, and I'm sure private business, because with private business, you're losing money by not doing your normal business and coming to these kinds of meetings. Even though there's a long-term incentive, I do understand small business, having run small businesses and sold them to a national healthcare chain back in the 80s, and my wife still has a small business, although that's in Federal Way. But I do live in Everett Sunday night through Friday, and I did buy a condo at the Nautica building. So I live there in a studio condo during the week and go home to my house in Federal Way on the weekend. I actually live here more than I do there. Okay, any more questions?
Sure.
First of all, Ken, I'm glad you finally admitted that you were a tyrant, because you still are a tyrant. So that'll take that back to the county with me. To follow up on what you just said, it's been an interesting day to kind of listen to different opinions about where we are. I too am wary of task force and meetings, and so I'm wondering, as we consider all of this stuff and we have this very, very structured process, is there a place out there in the world, in our country, that has experienced this and come through the other side, that we should be talking to, that we should be visiting? And instead of maybe trying to create our own solutions, is there a place or places that we should be talking to and just copying how they solve this?
I think there are examples, but it depends on what you're talking about. I don't think there's any city that I'm aware of or county in the United States that you could say is truly coordinating and collaborating effectively across all the silos. There are some cities who have done very well with trying to deal with the homeless issues. There are some that have done very well trying to deal with, jail diversion. There are some that have done real well with maybe some mental health services or alcohol drug services, but I don't know a single location, quite frankly, to be just perfectly honest, a single city who has really been successful in bringing all the players together and dealing with the multiple issues. I just don't know of any off the top of my head, and I've looked.
We are, this is not necessarily, I don't have a holy grail either, but we are reaching out to some of the communities in Western Washington who feel they have been particularly successful in one area or another, and we're trying to bring them to you at your September 18 meeting and to talk about the strategies that they did for, the one, David and I visited with some folks in Tacoma, for example, who said that they had reduced their urban homelessness challenges downtown by 80% in the last 5 years. And we said, wow, how the heck did you do that? So we talked to them for a while, and they're going to come up and share their experiences. And we're also reaching out to some other communities. I don't know of anybody that's done everything perfectly, but we want to try to bring some of those lessons learned from other places nationally and locally and spend some time on that later in the process if folks are still interested in doing that. Other questions for Ken? Where did that mic go? Oh, sorry. Ta-da.
I brought my own. No, thanks. So, Ken, when you talk about affordable housing, obviously we've heard folks discuss this time and in our previous meeting that that covers everybody who has difficulty making their resources match the cost of housing. So it's families and it's seniors and youth and a lot of folks. We see as human services providers that the challenge when it comes to taking someone who is homeless and getting them into an apartment or into something else, that's when it becomes a rub. But do you remember the magnitude or the amount of affordable housing that is going to be required in the next 20 years. So we talk about, what these challenges are going to be. That's an extraordinary number, and I cannot remember the exact number off the top of my head, but it is over 1,000 units a year, I believe.
22,000, I think the number was, right around 22,000 of affordable housing units will be needed by 2035. It's a significant number. And again, there's possibility of meeting that if we're willing to be creative. But if what we do is try to create 22,000 units of housing with the existing models and what those cost, it will be an impossible task.
Is that 22,000 countywide?
Countywide, yes. Yes, that's countywide.
Other,
The question, and how many were created in the last 8 or so years of this current 10-year effort?
I don't remember off the top of my head. So you're going to write that down as a question, right, so I can answer it later?
I think you said 1,100 earlier.
Well, it was about 1,100 as I recall, but I can't remember the exact number. And that remember that whatever numbers that I give you, it's kind of like the pit count. It's probably an undercount because there's some housing units that get created by entities where the money doesn't run through us, and they don't report on the housing management information system, so we have no way of knowing what they are or who they are or how many of those units there are. But clearly, yeah, I mean, if you're talking 2035, 22,000 units, gosh, countywide, and if in fact, countywide you had, even 40% of the people cost burdened that I talked about before, it's going to be a challenge, especially if we continue to build standard housing units and complexes that rent for current rates for a 1, 2, or 3 bedroom. There's going to be a lot of people that can't afford them. And there's not enough taxpayer dollars to do subsidies with Section 8 vouchers. So we are going to have to figure out a way to build real affordable housing, not subsidized housing. There's going to be some subsidized, but some of that housing needs to be, from the build point, affordable. And that means looking at something different than we're doing now. Okay, thank you.
Thank you, Ken. So just to practice our vocal cords, because you guys have been great listeners for the last 2.5 hours, 2 hours and 45 minutes. I want to just take that microphone and just, if everybody could just say briefly, I mean, we only have 12 minutes, so like 15 seconds, something that you thought was interesting or surprising or an issue that you were glad was brought up today, just so everybody has a quick chance to put something on the table. We'll start with David, just to make this low pressure. Just let's send the mic quickly around the room. Just get some thought out there, and I'll try to transcribe. Keep your phrases short.
As someone who works in a silo, I loved Ken's observations about collaboration across silos.
Thank you.
And although Ken and I have been meeting on the side in a very good way.
In a very appropriate
A very appropriate way.
Is that TMI right there?
Yeah, too much. And I've been thrilled every time we do about some ideas we're throwing around. Just to see the vastness of what the county does for us is amazing. It's vast. It was, even though, like I say, we've been talking quite a bit, it's vast. So, I'm so glad you're here.
Thank you.
Well, from my perspective, I think there's been a lot of great information today, and I always enjoy listening to Ken speak. And one of the interesting things that I'd be more interested in hearing about is the storage containers and some of these other, outside of the box, different ideas. And I think that you hit the nail on the head when you talk about looking at different ideas and not just continuing to do things, and we're talking about this in law enforcement at our department also, not continuing to do the things the same way we've always done them, but looking at new and innovative ways and ideas. So thank you.
Can I make sure that everybody understands, I'm not talking storage units, I'm talking shipping container units. Yeah. So be sure you remember that if you're going to Google. Don't Google storage container unit housing, shipping container housing.
He does this at home too. He monopolizes the meeting, just so you know. To kind of follow up on my comment, I think for me, it was, even as the sheriff, not fully grasping how vast the problem is and being a little naive and assuming that we could fix this with some hard work. And what I'm taking away today is that the problem's significant. I mean, and it's going to take listening to the business community and understanding the importance for economic development, but really that just being, like with the jail, one little tiny component of a very, very significant issue that we're going to hand off to our children and grandchildren. We are.
One of the things I think that is striking is that several people mentioned innovation. And one of the things that Evergreen Manor is fortunate to have is we got a transitional house for homeless men with the help of the city of Everett and the planning department, and the CDBG grant helped us pay the down payment so that we can house about 40 homeless men a year who are starting recovery from alcoholism and drug addiction. And we provide support services there, and it makes it affordable because we bought down the debt. One of my frustrations has been that I've got other ideas that I'd like to capitalize on, but the city of Everett doesn't allow their human services monies to go for adult alcohol drug services. So you might look at opening that up if you can, so that we would have an opportunity to come to you with some solutions.
Thank you.
Yes, one thing that I hope we will talk about more or look into a solution to is this issue where people might be eligible for federal or state services that could give them assistance now, but they're not necessarily getting plugged into that right away, and sort of the right hand not talking to the left hand. And I know that, for example, there's this 211 phone number people can call to find out. That's how we get a lot of people at the legal clinics who find out about free legal services. And so I wonder if there's some sort of little city position we could coordinate that would have the city taking care of, okay, well, you can go get this sort of federal assistance or state assistance that wouldn't necessarily cost us money in funding it, but in getting people to sign up for what they're already eligible for.
Thank you.
I've heard mentioned a number of times today the issue of feeling safe, from businesses to individuals, and I'd love to explore more what are the components that make somebody feel safe in a community. And also this question of density. I think there might be a correlation between density and feeling safe. I'd love to explore that, see if there's some research out there with regard to density. This may partly be an issue of small density, small issue, but it seems big because it's not a very dense population.
I think one of the most important things is the difference in housing. You can have, the container ships, or you can have something like a dormitory where they have their bedroom, but they do all the other things at a general location, the cooking and all that sort of thing.
I would agree with all of the ideas expressed so far, and I'm really interested in the thinking outside the box ideas, such as these shipping containers. That sounds really interesting.
I'm Joyce Stewart, and I supervise the 26 schools in Everett Public Schools. And Ken, I really appreciate the way you really highlighted the importance of all of us collaborating and coordinating our efforts more. We're all really working hard. I'm hearing that, but you're right. We are working many times in silos, and I think we can do a better job of collaborating.
I think the thing that I came away with is that there's a lot of money being spent on this. I'm wondering how much it's impacting it, and I'm wondering if, when we add up ER visits and jail time, and do we have a misallocation problem versus an underfunding problem?
Obviously, the problem is very vast and complex. Surprisingly, I'm encouraged to see how many competent and compassionate people are contributing to serve the people of our city. And so I'm largely encouraged. We have a lot of very intelligent people working on this. Obviously, the problem is going to exist. I don't think any of us are naive to think that this is going to go away or be eliminated on a permanent basis, but there are steps to take, I believe, based on some of the conversation and data we've been given. And I feel an overwhelming urgency that if we don't act now, this will only continue to get worse, and in a very quick manner. Just that last stat alone, about 1,100 perhaps affordable housing units built in the last maybe approximately 8 years, and needing to do that each year for the next 20 plus years. So I feel a sense of urgency to respond to this, and look forward to seeing some solutions.
Thank you, Matthew.
I thought it was interesting that we, each time somebody speaks, get a little bit better perspective of the complexity of the social interactions and the problem we're wrestling with. And I don't just mean from the perspective of what is the condition of people who are on the streets who are homeless, or what causes them to be there, or how might we solve their problem. I mean from all the things that Craig was talking about and others were talking about, the impact on businesses and on families and people who are coming downtown and the like. I think as we go forward, and especially when we start talking about solutions, we need to work very hard to try and understand the unintended consequences that may come out of decisions that we make. Because as it's pointed out by the sheriff, this is going to take a long time to implement fully. And change will happen, but it won't necessarily go in the direction we might have hoped when we're making decisions in here. So we might want to think ahead 10 years, what are going to be the consequences of some of the things that we try and do that need to be considered.
Great, thank you.
I'd put a checkbox next to the collaboration. I think that's a big issue between different services. And I'm also interested in learning a little bit more about intervention at the jail level. I apologize. It's difficult for me to hear in this environment, so I don't know if that was discussed in detail, but one of the things that I've learned about is that in other jails there's intervention where they try to line people up with resources so that when they're released into the community, they have support and they don't reoffend. I also, I think that's it. Thanks.
Thanks, Greg. Bob.
I was encouraged to hear that we're reaching out to some of the other communities and taking a look at their solutions related to the housing aspect. And one of the things that stood out in looking at the data is, I think is a real important number, is that median income. And I think you're going to see a true correlation to the communities that have found success and how they've done it, and take a look at their median income compared to our median income. And the other thing I really keyed in on was, the affordable housing not subsidized. So we may have to have a little bit of a paradigm shift on what we're going to do in this community as we take a look at this and find how we can be successful there.
Thank you.
For me as a service provider, it was very useful to hear from the business community and from Lainey, those perspectives, and I think having those voices at the table in the process will really help us think creatively about different ways to do things. So I think that really enriches our ability to find solutions.
Good.
I come from the business community, so I see these things happening a lot, just like we all do. But I leave here today excited and hope-filled that perhaps we really can come up with some sort of solution. And as much as we don't like committee meetings, we may be able to make a difference. I see that the power that we hold, and I really embrace that and hope that we can come up with longer-term solutions. And especially when it comes to reaching out to other communities that have successfully solved the problems we're facing, I'm thinking that that way we won't duplicate efforts and try something that might not work. So those are the things I was thinking about.
Thank you.
Difficult to give a microphone to a pastor for 15 seconds, right?
Work on it, work on it.
I was grateful for all the information that was shared. I think I agree. I think there's a lot of intelligent people around this this committee and in our community. I think the idea of the first impressions of what people see in Everett was really something that just stood out to me as a member of the faith community. I understand that directly. First impressions make a big deal and are a big difference. And so I think that was something that just really struck me, and I'm interested in seeing how we can think about that issue in our community.
Thank you. That was an excellent job of keeping it, really tight. Thank you.
I really want to thank the business community for being here. I think when we talk about these task force, we don't always have the voice of the business community involved, so I really appreciate the feedback. And my hope moving forward is that we can continue that collaboration with social service agencies and the business community to just enhance our customer service for everyone. And just on a side note, there is a national initiative for mayors to end vet homelessness, and that could be something that we could explore.
Thank you.
I too really appreciate the business community. Just one, as a service provider and advocate, that we can be better educators to the clients that we serve on how to be good stewards in the city. And also because we often look to the business community to be partners, to be employers for the people we're trying to help exit poverty. So, and just so you know, I'm not going to speak to it a lot, but the Housing Authority of Everett will be very active and is already active at how we are going to meet that 22,000 or participate in that 22,000 units of affordable, not subsidized housing, and we already have some. My 3 words or 4 words, I think, though, Karen, are education, prevention, intervention, and then suppression. That we have to be good at educating our community, talking about preventative measures like addiction, mental health, things like that. What interventions are healthy and working, and then talk about how suppression is often a part of that partnership to get things happening, but we have to have that discussion and partner the collaborative part.
When you say suppression, what do you mean?
Like law enforcement, like
Okay.
when somebody has to be, detained, and because that happens.
Thank you.
I agree with the education piece. I think that younger children today are getting hooked on very bad drugs, and we need to have, if it's not already in place, I know in my neighborhood, the DARE program was eliminated. My kids had no idea what that was. And I remember taking away a lot of things from that when I was 12 years old. So I believe that needs to be put back in place. I would also like to look at ways when people get out of detox, where do they go? If they get out of detox and they just go straight back out on the street, isn't that being homeless? So we need a long-term plan. Detox, inpatient, sober house, to get these people on their way. Thanks.
Thanks, Nora.
Speaking for a business, I think a lot of businesses in this area support a number of the nonprofits that are in this room, and on our side specifically, being in the transit station area, we deal with a lot of these problems. We'd like to see them solved, and we as a business have supported a number of these nonprofits to try and help them solve those issues. So I know sometimes the business community doesn't necessarily get the best light, but I think a lot of the nonprofits are doing what they can do with the support of business. So,
thank you.
I'll pass since I already talked a lot.
Very gracious, very gracious.
I'm very interested in the concepts of collaboration, innovation, and education. I've seen a lot accomplished through innovative collaboration with a hospital working with some agencies that we don't historically. Also just really interested in the concept of population density, having lived in a rural environment and felt safe. Los Angeles, extremely urban, not a great neighborhood, felt completely safe, interesting. Everett in the middle, and just that concept of if we can bring more people to downtown and have that population density, how that perception changes.
Thank you.
I agree with so many of the comments, so I'm not going to reiterate them all, but I really like the collaborations, finding a way to be more active action-oriented because we all spend a lot of time trying to collaborate, and it's really hard to do when there's no money to do so. So having those collaborations be solution-based and leaning them out so that there's fewer of them, and new solutions to old problems, but keeping in mind what Bob commented, that we also need to think about what that means long-term, and so kind of continuing also the best practice solutions that we already have in place as a community.
Great.
I got really excited hearing about how we have the opportunity right now to grow, and there's so much space, and there's so many different ways that we can grow. And then looking at our middle income and what that is, and creating housing for people, and thinking of this outside the box, and thinking about this in a sustainable way so people can afford to live here, and that could enrich our community also. So I think now is the time to bring all this up, because we have so much open space and so much opportunity to grow in a way that could really benefit Everett. And I got really excited hearing you speak, Ken, and what you brought to the group tonight. Thank you.
It's quite apparent that we're tackling a very complex issue, and the charge is to look at the downtown Everett Street situation. But these issues, as Ken articulated, are countywide issues with challenges in all of our cities and in the rest of the city of Everett as well. And to craft a solution focused narrowly on the downtown area is going to be difficult, because resources are already in play trying to address the very needs we're talking about in a very broad way, countywide. I think we're going to have to figure out a system, how to build a system. I like Ty's question about, are there models elsewhere in the nation that might be instructive for us? And one of them I would point to, I got to go with the Gates Foundation to Columbus, Ohio, to look at the Community Shelter Board initiative and the Rebuilding Lives program, which brought corporate entities, public jurisdictions, nonprofits together to create a system that has received national acclaim. It would be one of those I would suggest we look at, but I would hope that we could find ways of exploring where else there are models that could benefit us in our thinking of options that would be designed to break down the silos in a system, a model that would channel our resources efficiently and effectively towards. I'm not hopeful that we'll find models in the state of Washington. I'm pretty acquainted with what's going on in this state, and I think we need to broaden our search beyond what we have in our state.
First of all, thanks, Ken, for the presentation. There's a lot that I learned from that, so I won't repeat all the comments. But the one thing I do want to add real quickly, because I know we're out of time, is as you all do your own research, and I know you have, because I know there's a lot of sub-conversations going on in the community around this. As you do your researches and you look at what's going on in other communities, make sure you email us. Let us know what you see out there, and it'll help us build into the presentations that you hear educational pieces, and it'll help give us some direction in terms of where we're going as a task force. So thank you, everybody.
Great. Thank you. Sorry that we did go a couple minutes over there, but I appreciate everybody for taking a shot at a microphone comment there. We're out of here for now. Our next meeting in 2 weeks, same time, 3 o'clock. We're going to focus on the public safety criminal justice system, the sheriff, courts, jail, police, prosecutor, public defense, probation. They're going to talk to us about that end of the system, and then we're going to throw it open just to other ways, broader discussion with you all. How do we connect people that need services to those services? Are we doing it well? Where are we falling down? What can we do better? Thank you, everybody, very much. Have a great evening. We'll see you in 2 weeks.